MRCP UK has reviewed the current PACES exam and will be making some changes to the stations in 2023. The changes will build on the current format but develop some elements to make them more realistic for examiners and trainees. The examination will still test the same clinical skills, which are Skill A, physical examination, Skill B, identifying physical signs, Skill C, clinical communication skills, Skill D, differential diagnosis, Skill E, clinical judgment, Skill F, managing patients' concerns, and Skill G, maintaining patient welfare. There will still be 5 stations, however some of the encounters are changing. Each station will continue as a 20-minute encounter with 5 minutes between stations. The total examination time of the carousel will remain as 125 minutes. Why are we changing the examination? Postgraduate medical examination has undergone significant changes in the 10 years since the current PACES examination was introduced. The shape of training review, the new internal medicine curriculum, and a number of different central government reviews have helped us to understand the expectations patients have of the doctors that treat them. The PACES23 changes are the product of an extensive review of the examination in the context of these developments as part of the regular quality assurance processes all MRCP UK examinations have. These processes make sure that the examinations remain fair, relevant, and fit for purpose. This slide shows the current pre-2023 PACES carousel. Stations 2, 4 and 5 will be removed. History taking at Station 2 can be artificial with structured history taking skills being tested in isolation. The 20-minute single communication and ethics encounter at Station 4 is felt to be rather long, and in particular the 5-minute examiner-candidate interaction adds little value to the candidate's overall assessment. At Station 5, candidates and examiners both report significant time pressures undertaking 2 brief clinical consultations. Testing all 7 skills in an integrated manner, however, is very like real life, but too pressured in 10 minutes. Proposed therefore to introduce 2 new encounters in the PACES23 carousel that will continue to test all 7 skills, but in a better manner. This illustrates the old carousel with the new carousel for PACES23 on the right-hand side. This helps illustrate the new encounters which will be introduced in 2023. There will be 2 new 10-minute communication encounters assessing candidates on their communication skills. These encounters will no longer include a question and answer section with the examiners, with the encounter being judged on observation alone. These 2 encounters will be at Station 1 prior to respiratory examination and at Station 4 prior to the abdominal examination. 5 minutes reading time will be provided prior to entering. The communication encounter will always precede the clinical examination of either the respiratory or the abdominal examination. At Stations 2 and 5, there will be 20-minute clinical consultations which will assess candidates across all 7 skills in a realistic and integrated manner. Candidates will have 15 minutes to take a structured history, examine the patient, explain the likely diagnosis and management, and address any questions or concerns raised. The patient may give the history for themselves, or a surrogate may provide the history on behalf of the patient. After 15 minutes, there will be a 5-minute question and answer interaction between examiner and candidate. Station 3, involving examination of the cardiovascular and neurological systems, will remain unchanged. Videoed examples of the new encounters are available on the MRCP UK website.